The Health and Human Services budget makes up the largest chunk of the state budget after E-12 education spending. During the 2017 session, lawmakers grappled with the need to maintain key services as costs continue to rise. Joining me in the studio to discuss the HHS budget is the chair of the Health and Human Services Finance Committee, Senator Michelle Benson. Welcome.
Glad to be here.
There is bipartisan agreement that projected spending for health and human services is unsustainable into the future. The HHS budget passed this session appropriated an additional $2 million for HHS, but fell $463 million short of the projected need. Where were you able to find the cost savings in order to do that?
Actually, we took money out of the Healthcare Access Fund, so the numbers you're talking about are general fund money. And so we funded above forecast by taking money out of the Healthcare Access Fund and using some access to reserve funds. And so we actually went well above forecast. The governor had set very aggressive goals for sex offender programs and for increases in operations. And so to come to a resolution, we had to fund those areas that were governor priorities. And so it meant taking money out of the Healthcare Access Fund to do that.
One criticism that I've heard in terms of the Healthcare Access Fund, that money was used to fund several things. And the funding for that comes from a tax on providers, which is expected to sunset in a couple years. Are you concerned about how we're using that fund and the fact that it will sunset? Is that a concern to you?
It is a concern, and as the individual responsible for carrying the bill in the Senate, it was very tough to negotiate governor priorities and protect the Healthcare Access Fund. And so I'm going to be looking for ways that we can backfill some of that money if we get the opportunity to do a second budget in this cycle, if we have opportunities for savings, getting some money back in there so that we have a little cushion for what might be coming from the federal level. But going forward, the general fund is going to have to support more of human services, and it means more legislators and more citizens are going to have to understand the spending in human services. They can't count on this special set-aside fund to keep human services funded.
In funding this bill, were you able to find some cost savings even for this next biennium? I know that was important to you.
Yes, we asked that the department take a 1% reduction on forecasted growth for some very specific programs. And I know that's complicated for your listeners, but our budget forecast starts out with the assumption that the population will grow and expenses will grow and there will be inflation, and that's all built in. And so we challenged the department to find a reduction in that growth for limited categories. It's a total of about $35 million. And then additionally, we put auditors in place because, as you may have seen in the news recently, there are problems with program integrity in human services. We want eligibility verified. We don't want people from Ohio getting our tax dollars. And so by putting those auditors in place, we think we're going to see a path forward to better reforming and holding those programs accountable.
In the bill, almost $500,000 was allocated for self-advocacy efforts for individuals with intellectual and developmental disabilities. How will these grants allow people to customize their state assistance?
And one of the important things that has been happening with bipartisan support is that individuals with disabilities, cognitive impairments, or physical impairments, instead of us saying, you know what, you can't take care of yourself, we're going to put you in a safe place and make sure you have food and make sure you have care, that those individuals get to stand up for themselves and say, you know what, I can live where I choose, the state can support me in these ways, but I want to work and live in my community. And those grants are specifically to help break out of this pattern of you live in a group home, you go where you're told, when you're told, and we need to help people make that transition, because if you've lived in a group home for 20 years, you don't know how to access services outside of what you've known for most of your adult life. And so that's what those grants will be helpful in doing.
So it's kind of a tool to help individuals have more say in how they live and what services they use.
Right. There are many people, you know, if you have Down syndrome, you can live in an apartment, maybe with somebody else. You don't have to live in a group home. You can choose to work customer service, perhaps at Target, assisting people find things. We're changing the way we view people with disabilities, and that means we need to change the way we help them live their lives fully, and those grants are part of that.
There are also significant fee reductions in this bill for parents with kids on medical assistance who need special services. Why was this important?
There are families who have incomes above what qualifies for medical assistance, but their children have such severe, serious physical impairments or cognitive impairments, disabilities, that they simply can't afford the coverage for their children. And so we let them buy down a little bit until they qualify. It's TEFRA. It was a federal program, actually started under Ronald Reagan, and it gives those children access to therapies at places like Gillette or Children's Hospital or the University of Minnesota for some pretty severe disabilities without bankrupting the families.
Are there any other aspects of the bill that you're pleased about?
You've hit some of the high points, that we continue to focus on the disabled and helping them live independently, helping families with children who suffer impairments of some kind. We also are working very hard to have the elderly, we say, age in place. It doesn't sound very nice, but if you want to live in your home and you can't take care of yourself, a nursing home doesn't have to be the first step. It can be the last step. So as you're aging in place, do you need somebody to check on you periodically instead of having you move into assisted living? Let's see how long we can keep our aging parents, our baby boom generation, in their homes or in a low level of care, instead of just assuming that everybody who can't prepare their own meals needs to be in a nursing home, or everybody who can't organize their medicines by themselves needs to be in a nursing home. There are some things we can still do at home with a little bit of community support, and for our medical assistance population, that matters a lot, because nursing home care is the most expensive medical assistance care. So we're trying to bend the cost curve by having people live independently.
Senator Benson, I want to thank you for your time today.
I'm glad to have been here. Thank you for the invitation.